From miracles to heartbreak, healthcare workers see a lot within the walls of a hospital, especially during the last 7 months of this pandemic. While nurses and doctors help people physically battle the coronavirus, one person is there to help them with the mental struggle: the chaplain. In a 4 News Now exclusive, Elenee shares the story of COVID-19 in hospitals through a chaplain's eyes.
It's really heartbreaking to see the family's heartbreak.
Sarah Brody was one of the first chaplains ready to help when 4 patients came from a cruise ship to Sacred Heart in February.
I've stood alongside ICU staff members at the end of a shift where we have all wanted to weep together for what we've seen this disease do.
Over the years, Brody has been there for many patients' last few moments.
We don't always cure people, but we can always help foster a sense of healing. And our chaplains play a really key role in walking alongside people when they're vulnerable.
For months, the pandemic prohibited families from visiting, so sometimes someone has to say goodbye to a loved one virtually. Even though Brody doesn't get to actually be next to the patient, she's outside of the room, it still hurts all the same.
It's been a very emotionally trying time. The visitation, the end of life, the isolation, that's been a moral distress that as chaplains we've carried, and I think most of our caregivers have been carrying that weight as well.
Chaplains normally touch people to help comfort them, but as you can imagine, during the time of COVID, they can't do that, and that's been tough on Brody.
Even though Brody sees the devastation the virus leaves, she tries to stay positive.
Often the yin and the yang go together, and so when you're in the middle of the darkest things, to remember that along with that comes the light. So I've definitely seen that here.
In Spokane, I'm Elenee, 4 News Now.